Hello everyone, welcome to Maternity Nursing 1. Today I am Ms. Kinan presenting the slides of antenatal care concept by Nurse Ballet Lydia Ingrid. And in these slides, we are going to learn about the concept of antenatal care, the history of pregnancy, as well as nursing care for antenatal. So, what is conception? So, conceptions is when the cell eggs of women meet the sperm of the men, and there will be conception. And this is actually how ovulations is happening. So, in the prenatal period, the ovary will produce egg, and after the ovary produce the egg will travel down the fallopian tube, and then the fertilization will happen when the sperm get into inside the eggs, and we call it as day one. And then the cell, it will then develop to zygote, walk through the fallopian tube, and as in day one it will be only two cells, and day two will be four cells, and until at day four it will be morula. And then this morula will then travel to inside the uterus, where the blastocytes will implant in day 7. Then when the blastocytes already implants, then it will become embryo, and then the pregnancy will begin inside the endometrium. So what is prenatal period? So prenatal period actually consists of psychologically and biologically. So psychologically is where the human life begins, when the fetus begins to react to external stimuli, and then this begin very early in the life of the fetus. And biologically, the conceptions actually, or the fertilizations, it's where the union of the egg or the ovum and the male cell or the spermatozoa uh, be together. And these united cells will grow and develop inside the female reproductive organs, which we call uterus. So this is female reproductive system. You can see the vagina down here, and then you will have the cervix, and then you will have the uterus, consists of the endometrium and then the myometrium, and then we will have the fallopian tube on the right side and fallopian tube on the left side, and then we have the ovaries. So the fertilizations and implantations happen when there is ovulations, and then sperm meet the eggs by the fallopian tube, and um, there's what we call day 0 or the day of fertilizations, and then in day 1 there will be the first cleavage division, and then on day 1 it will be 2 cell stage, and day 2 will be 4 cell stage, and day 3 will be early morula, and day 4 will be advanced morula. And on day 6, then this morula will become a blastocyst, and it consists of blastocell, the inner cell mass, and then the trophoblast. And it will transfer then to the uterus. Then it will also be planted or do the implantations in the uterine wall around day 7 to day 10. The fertilizations process happen once every 28 days, and it's in the middle of the menstrual cycle. So the egg in one of the ovaries will matures and then slowly move down to the uterus. The journey take 3 to 7 days, and if fertilization does not occur during the journey of the egg, then the menstruations will happen. When then the egg meets the spermatozoa on its way and enters the egg cell wall, then germ the germ cell will release 23rd parts of chromosomes, and then the egg nucleus break, and then there will be also another 23 chromosomes that are released. And these chromosomes contain smaller part that carry the hereditary factors, which we call genes. So after the fertilization, the pregnancy happened. So as the Federations of Obstetric and Gynecology International mentioned, pregnancy is defined as the fertilizations or the union between a sperm and an ovum that followed by implantation. So pregnancy is actually the period from conception to birth, and a normal pregnancy lasts 280 days or around 9 months and 7 days, and it is calculated from the first day of the last menstrual period. The first trimester lasts 12 weeks, the second trimester lasts 15 weeks from week 13 to 27, and the third trimester lasts 13 weeks from week 28 to week 40. So as you can see, these are the pictures when the mother is actually having pregnancy around 1 month, and around 2 months, and around 3 months, then around 4 months, where the baby is fully developed but not big enough. And then you have the fifth month, the sixth month, the seventh month, and then the eighth month, and then until finally the baby is ready to be delivered or be born around 9 months. So, what are the signs and symptoms of pregnancy? To define the pregnancy, you must have the fetal movement, including the fetal parts that can be seen, felt, or touched. And you need to have the fetal heartbeat, which can be validated through a monocular stethoscope, or can be recorded and heard with a Doppler, or can also be heard through a fetal electrocardiogram machine, or can also be seen through an ultrasound. And actually, the fetal bones will be visible through an X-ray. So these are the signs of positive pregnancy. And there are also few presumptive signs of pregnancy, such as amenorrhea. So the women will have absence on menstruations, and we can count the gestational age from the first day of the last menstruate, an estimated due date, and also using the Nagel's rule, where we then added 7 to the day, and then minus 3 to the month, and then probably plus 1 to the year. And the woman can also experience nausea and vomiting, or what we call emesis. This might be occurring in the morning, and these conditions can be called morning sickness. Some women also experience fainting. It's because there is an impair of circulations from the head area. And some women also have what we call cravings. So it's a desire for a special kind of food. Some women also have anorexia, where she become loss of appetite, especially in the first few months of pregnancy. And women will also complain of frequent urinations because the bladder is actually being compressed by the enlargings of uterus in the first months of pregnancy. So the uterus is getting ready to host the baby for the next 40 weeks. Some women also complain of constipation because the muscle tone is also decreased because the progesterone hormones is being influenced in order to prepare for the baby. Some women also complains of skin hyperpigmentations, and also some women express weight changes in their body weight. The signs of possible pregnancy can be identified as 9. We have what we call Heger sign. So this is when the lower uterine segment is soft to touch. We also have what we call Chadwick sign, when the vagina showed bluish discolorations. It actually happened around 6 weeks. And we also have what we call Piscasex sign, where the growth of the uterus near the placenta is asymmetrical. And also we have what we call Braxton contractions, where the uterus will then contract because it was stimulated, and this is a typical sign of uterus during pregnancy. And we also have what we call Goodell signs. So this is actually detected through a bimanual examination. So the cervix will feel softer, and then this can also happen when the mother or the woman is being used the contraceptive orally. So it can also give the sign of Goodell sign. Then the next one is what we call McDonald's sign. So this is where the fundus of the uterine and the cervix can easily be flexed toward each other, and this is also according to the softness of the isthmus tissue. Next is that the abdominal of the woman might seem enlarged, and also there will be few uterine contraction, and also the normal test that we do to reveal if it's pregnancy is the biological pregnancy test. So if the test is positive, even if it's although false positive, it's also possible that the woman is then being pregnant. Now we move on to the physiological changes during pregnancy. The first thing is the uterus. So the uterus will increases in size. It will weigh up to 1,000 gram from the original weight of 30 gram. And the size will be around, the length will be around 32 centimeters with the width of 24 centimeters. And if we measure from front to back, it will be around 22 centimeter. And this enlargement is actually caused by the hypertrophy of the uterine muscles, but then the new muscle cells also develop during the early pregnancy. The next changes that will happen is the vagina and vulva. So there will be hypervascularization in the vagina and vulva that happen because of the changing in the estrogen. So sometimes this will cause vagina and vulva to be bluish in color, and sometimes like very red. And the next one is about ovaries. So one, the pregnancy happened, the ovulation will ceases, and then the corpus luteum will remains present until the placenta forms, which take over the productions of estrogen and progesterone. And what we also will see that the breast of the mother will slightly enlarge because the alveolar is having hypertrophy, sometimes also cause hypersensitivity, but the breast is preparing itself to welcome the baby and to produce milk in the future. The other physiological changes is actually blood volume. So the blood volume will increase. There will be increases in the plasma and also erythrocyte that sometimes will lead to more prominent hydration, and actually the hemoglobin level of the mother will decrease. Now, what happened in trimester 1? So trimester 1 is around 0 to 3 months, or around 1 to 13 weeks. And this is where the fertilized egg cells grows and develops, and it's divided into three phases: the ovum phase, the embryo phase, and then the fetal phase. So the ovum phase takes around 10 to 14 days after fertilizations, and then the embryo phase is actually the process when all the major organs of the baby started to develop, and this lasts around 2 to 8 weeks. And then the fetal phase is actually when the cells already become a fetus, and it lasts from the week 8 until birth. On trimester 2, or around 4 to 6 months of the pregnancy, 14 to 26 weeks, this is what we call the period of rapid growth. So here we can start to listen to the fetal heart sound, and we can also see the fetal movement, and we can also see that the fetus is around 30 centimeter long, and then it's around 600 grams in weight. And we can also do examinations during this time by checking the weight and the blood pressure, doing the urine test, and have the heart rate of the mother and the fetus examined. The examinations also can happen to the mother through her feet and hands to check if there is any swelling or any other common symptoms that is uncomfortable for the mother. Now, on trimester 3 or around 7 to 9 months, which happen in 27 to 40 weeks, this is actually where the fetus start to shape and actually all the organ develops and preparing itself for birth. At this time, the fetus will weigh around 2500 grams in this trimester, and then actually the doctors or the healthcare professionals will ask to do more frequently and usual checkup. Sometimes could be twice a week. Now, what are the psychological adaptation? So the first thing is actually the maternal adaptation. So the mother, she needs to adapt to the conditions of the pregnancy and preparing for the birth and also to take care of the baby in the future. And also there is a paternal adaptation. So this is where the partner, the father start to become the only support system for the mother and the baby, and how in the process of pregnancy and in the process of delivering the baby as well as postpartum, how the father, the paternal or the partner can provide a very adequate support to support all the changes that is going on inside the mother. Then we have what we call grandparents adaptations, because sometimes it's kind of difficult to accept that somebody is pregnant, but it's also sometimes it's very delightful to know that the parents now are going to become grandparents, and it's kind of like have a lot of expectations, also have a lot adaptations, which also needs to be embraced very diligently towards mother, father, and grandparents. And another adaptations that is very important also to happen is about siblings. So if this is like the second baby, the third baby, then the siblings needs also to make adaptations related to the additional family member, because they can be sibling rivalry, they can be siblings overprotective love, or there can be a difficulty to adjust between the father and the mother related to the new baby that is born. Now, we are going to move to the antenatal nursing care. So we are going to see what can we do when we are helping the baby inside the womb. What are the things that as a nurse we can give to our patients? Of course, the first step is we do assessment. So we do identifications and we collect the medical history, we collect the general personal data, we collect the current complaints related to the pregnancy, we collect the informations about the history of pregnancy, of childbirth, whether this is like the first child, this is the third child, or even this is a child after an abortion. And we also collect data about the current pregnancy history. When is the last menstrual date? What is the current complaints? Do they experience morning sickness? Is it very difficult to sleep? Do you have any other symptoms that are needs to be assessed by the nurse, so that we can then create the perfect nursing care plan for the mother and the baby as well as the family. So we also collect family medical history. For example, there is history of abortion, there is history of gestational diabetes to the mother, there is history of asthmatic from the father, there is history of allergic from the mother, and also history of mental illness or hereditary diseases that we probably need to assess. We also need to assess if it's the first pregnancy after the mature age, like for example 40 years old mother. So we can do the medical history thoroughly and deeper to see the possibilities of this current pregnancy. Now, after that, we perform head to toe examinations. As usual, we observe the general condition, we do abdominal examination, we inspect the size and the shape of the abdomen, we see if there is any scars of the abdomen, we see the signs and of the pregnancy, we see also if the fetus already being moved, like able to move inside the abdomen. We also assess whether there is a build varicose veins and dilated veins, and we ask also if there is any hernia anywhere, umbilical or lumbar hernia, or also edema on the feet, on the hands, or wherever. So these are the things that we need to examine on our patient. We also do palpations to palpate the fundal height of the baby. We can also palpate the baby's back. We see the presentations and we see how far the baby is presenting the part inside the pelvic inlet. So this is what we do on the mother's abdomen when we are performing the maneuver, the Leopold maneuver. And then we continue with auscultations. So if it's like 10 weeks, we can hear the fetal heart rate through the Doppler. And if it's like 20 weeks, we can hear it through the pinart of the fetoscope. So we ask the mother to really check on the baby very frequently. Now, we also have supporting investigations during the pregnancy. So we ask the mother to check for the laboratory result for the hemoglobins, the whole blood check, to make sure that the mother have enough hemoglobin, have enough blood level that is needed for the baby to grow up until delivery. We also do ultrasound. The routine ultrasound will happen during the 18 to 22nd weeks of the pregnancy to identify the fetal abnormalities. We sometimes also do the blood test to check for HIV or for hepatitis, whether it is possible for baby to contain viruses from the mother. Now, after we assess the patients, we create the diagnosis. So we create the nursing diagnosis according to the conditions of the mother. So according to the trimester 1, trimester 2, and trimester 3. For example, in trimester 1, the mother will feel fatigue, the mother will have morning sickness, so we can do that as a nursing diagnosis. And when moved to trimester 2, the mother will still feel fatigue, the mother won't be able to walk so fast, have the tendency to wants to sleep all the time. And once mother moved to trimester 3, the mother has like a lot of energy to do everything, but then the mother has the bump, so the mother needs to adjust to the way of she performing her needs daily. So we can take a look at the nursing problems through Nanda books, or also through the Nick and Knock or Indonesian nursing diagnosis book as well. So example for the nursing diagnosis will be like nutritional changes less than body requirements, and there will be like anxiety, impaired comfort of pain, and also changes in sexual pattern. So these are the example that you can use to create a nursing care plan for your antenatal patient. After that, you perform the implementations according to the problems that you take. For example, anxiety, we do implementations of chem therapeutic therapeutic management, such as relaxation, also massage. We perform that during the antenatal nursing care, and then we evaluate whether what we implement to our patients will be beneficial or whether it will not help the mother to be more relaxed during her pregnancy. So that's about antenatal nursing care. We are going to move to the next topic. Thank you for listening. God bless you.